Hi, my name is Dr. Rachel Venable, and I'm a veterinary medical oncologist. And today we're going to talk about what is lymphoma. Lymphoma is a cancer of lymphoid tissue, like your lymph nodes, but it can happen in the spleen and bone marrow and actually any tissue in the body because your lymphatics go all throughout. And there's actually all different kinds of cancer subtypes. Even in dogs and cats, lymphoma isn't really one thing. There's all different kinds of versions of it. And certainly in people, we know there are several different types of lymphoma. Lymphoma is actually the most common cancer in dogs, and we don't really know why they get this. It's thought to be a multifactorial process, so it could be several things. Genetics certainly seems to play a role because we know that certain breeds are more predisposed to developing lymphoma. Golden retrievers, I love you, but you are certainly a breed that's at pretty high risk for this. Also boxers, that's another one where we can commonly see lymphoma. So what does lymphoma look like? If you're a pet owner, typically what you're going to notice is just some abnormal swelling. A lot of times people will say that, they were petting their dog or feeling around their neck and they felt some new hard lump that they swear wasn't there just a few days ago. And, honestly, you're not going crazy. It probably wasn't there. Lymphoma is something that can move really quickly. And so we can see swellings pop up and grow over just a matter of days. It's not something that typically happens over months. And dogs have lymph nodes right here at the corner of their jaw, also at their shoulders or behind their knees. Those are other areas that owners will commonly feel just petting their dog, or maybe the way they're laying, they might notice that, there's a new swelling, there's a new bump there. Sometimes they're actually sick, so their appetite's down, maybe vomiting or diarrhea. Sometimes we'll see trouble breathing, especially in more aggressive forms of lymphoma. But a lot of times dogs actually feel pretty normal and people just feel a lump. Cats usually have GI upset. They more often get lymphoma in their abdomen. And so generally what owners notice with them is their appetite goes down. And a lot of times they have vomiting and or diarrhea. So what's your vet going to do, especially if you're worried about lymphoma or your vet's worried about lymphoma? Typically, this can be diagnosed with something as simple as a fine needle aspirate and cytology. A fine needle is where we take a small needle, like what we use to collect blood. Your vet will then poke it into the lymph node, and then they're able to put those cells on a slide that we can then look at it under the microscope. So we send those out to the lab. Pathologists will take a look at it, and majority of the time, we're able to get a diagnosis from something as simple as that. Sometimes you need to do like a surgical biopsy, but not too often with lymphoma. Cats, usually you have to do more advanced imaging, like an abdominal ultrasound. And again, that's because their disease usually starts in the abdomen. Dogs, you can also have to do imaging like chest x-rays, ultrasound, CT scan. There's all kinds of things. But normally, if you feel a lump and your vet's going to recognize if those are lymph nodes, they'll sample it and then you can go from there. Blood work's also recommended though, because that's another very simple, pretty non-invasive test that can give us a lot of information about lymphoma. Because if we see that there's lymphoma in their blood, so on that blood test, then we know it's a lot more aggressive disease. So are there any treatments? Well, there's actually a lot of treatments. Being that lymphoma is fairly common in dogs, there's a lot of different things that we can do. And it is a very aggressive disease, but it actually usually responds pretty well to therapy and pretty quickly too. Chemotherapy is the main treatment. I know a lot of people cringe when you hear that word, but actually remember, chemo in our pets is much different than in people. People, chemo's terrible, but in our pets, they actually tolerate it really well. And in veterinary oncology, quality of life is our primary objective. We want to give your pet more time, but we want to make sure it's good quality time. And so that's another reason why things are a little bit different in vet med than it is in human oncology. There's all kinds of chemotherapy options. There's pill ones, there's IVs, and really what you choose depends on the type of lymphoma, but also depends on, what's going to work best for your family and for your pet. Some of these treatments can be fairly intense where you're going in to see your vet on a regular basis for several months. Some of the treatments are only every 3 weeks to 4 weeks, so about once a month. So there's all kinds of factors and all kinds of things to think about. So talk to your vet, get a veterinary oncologist and learn what are the different options, know the details on all those options, and what makes this most sense for your pet and your family. Check us out online at our website at petcancercareconsulting.com, where you can connect with a veterinary oncologist to work with both your family vet and you to help give you answers about your cancer, testing, treatment, prognosis. We can also help with any follow-up or comprehensive protocols that you would like to do with your vet. And also check out our blog where you can get some more information on lymphoma in animals. Thanks, guys, and let's get the care your pets deserve.